To understand why diabetes can affect our feet, we need to know a little about healthy feet. The foot is made up of 26 bones, 19 muscles, and about 30 joints, bound together with joint capsules, ligaments, and tendons. It is a miracle of natural engineering and has to be able to withstand all the work that feet are required to do. The average person walks 2,500 miles every year. That is the same as walking all the way across the USA from New York to San Francisco. And that is 4 times round the earth in a lifetime. Poor foot function can lead to calluses and corns, injury to bones, joints, ligaments, muscles and tendons, resulting in painful deformities and lesions.
I think it's really the loss of sensation, particularly in this foot, that is the concern. Well, we just need to keep an eye on it, because you could develop, if we didn't keep an eye on it, you could possibly develop another neuropathic ulcer. Yeah, so we need to really watch that. Yeah, and it's really the most important thing is footwear.
Poorly fitted shoes can cause excessive pressure and friction and disturb the normal function of the foot with the same result. It is not surprising, therefore, that most people experience a foot problem at some time in their lives, whether they have diabetes or not.
When you have diabetes, your feet need extra care and attention. High blood sugar levels from diabetes over several years can damage the nerve endings and blood vessels in your feet, making you less likely to notice when your feet are injured. Diabetes also interferes with your body's ability to fight infection and to heal after an injury. If you develop a minor foot injury, it could become an ulcer or develop into a serious infection. With good foot care and good control of your blood sugar levels, you can prevent most of these problems.
Can foot problems be avoided?
The best way to avoid foot problems is to prevent them. That means looking after your blood sugar levels so that your blood vessels and nerve supply are less likely to get damaged, and it means taking care of your feet every day so that infections don't develop. If you develop good foot care habits before you have foot problems, you will find it much easier to keep up the habit when you do have a problem. You may not feel it when you have a small blister, cut or scrape on your foot. If you check your feet every day, you'll find minor problems earlier. Have your podiatrist treat minor problems to prevent more serious ones later on. Caring for your feet is easy. Most of the care can be done when you are bathing and getting ready for bed. Preventing injury to your feet is simply a matter of wearing properly fitted shoes and socks at all times. Making foot care part of your daily routine. Soon it will become as automatic as brushing your teeth. Good foot care involves getting help early if a foot problem develops. Getting help for minor problems can prevent serious complications such as infections and ulcers.
Caring for your feet when you have diabetes involves getting into good foot care habits. Wash your feet every day. Dry them carefully and properly. Then inspect the skin for blisters, cuts, cracks or sores. This is the most important part of your foot care. You can use a handheld mirror or magnifying mirror to inspect your feet. If you can't see well, ask someone to help you. If your skin is dry, apply moisturizing skin lotion or cream daily, and keep your nails trimmed and filed straight across. Wear shoes and socks that fit well. Shoes that have soft uppers, good support, and that fit well are best for your feet. It is important to wear properly fitted shoes at all times in order to protect your feet from injury, even when you are indoors. Wear socks that do not have seams. Try to develop the habit of being cautious with your feet, protecting them from anything that can cause possible injury. Inspect your feet for blisters, cuts or scrapes after activities such as hiking or skiing. Before you put on your shoes, check for objects such as stones or rough spots inside your shoes, or for sharp objects pushing through the soles. Avoid too much heat. Don't use a heating pad or a hot water bottle to warm your feet, because you might not feel if it is too hot and so suffer a burn. Instead of outside heat, wear warm socks. Have your podiatrist or your doctor check out any foot problems. Avoid trying to treat foot problems yourself. Home remedies or treatments you can buy without a prescription, such as corn removers, can be harmful. Most foot problems need to be treated by your podiatrist. See your podiatrist at least annually to check for foot complications. Get early treatment for foot problems. A minor irritation on your foot can lead to a major problem if it is not properly cared for early. Contact your podiatrist if you have foot problems, unless you have already learned from your podiatrist how to handle these problems.
I think we have covered quite a lot there. Just to summarise, try to get into these 5 good habits. Keep your blood sugar levels under control. Wash and inspect your feet every day. Wear well-fitting socks and shoes to protect your feet. Check inside your shoes before putting them on. And if you do develop a foot problem, get help early.